Welcome back to the cityCURRENT show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're honored to be with our good friend, Jenny Koltnow. She is Executive Director of the Campbell Clinic Foundation. How are you doing, Jenny?
I'm great. I feel like I should be running onto a field with that intro.
Hey, you could. We'll put some, put some hype music in the background.
That's right.
So, we'll make it worth your while for sure. Make it fun. But hey, you got a lot of good going on, so that makes it a fun conversation. But
That's right.
Let's start out on your end. Give us a little bit of backstory, because it was the Campbell Foundation for so long. Now it's the Campbell Clinic Foundation, tied to the amazing efforts of Campbell Clinic. And so give us a little bit of history and perspective for the Campbell Clinic Foundation.
Sure. So this year, kind of in anticipation of the Campbell Foundation's 75th anniversary, our team went about a process to look at our strategy, look at our brand, really look at how we can better connect with the greater Memphis community and the patients that we serve here and everywhere. And one of the really exciting iterations from that is actually rebranding and also renaming the organization. And so now we are proudly called the Campbell Clinic Foundation. I know it's a huge deviation from where we were before, but it's also an opportunity for us to leverage the connection and the reputation of the Campbell Clinic, while reinforcing to our patients and to the broader community that the Campbell Clinic is an incredible corporate citizen.
Absolutely. Talk about what the foundation does. So we'll kind of dive in there. You do a lot. So go ahead and talk about what you do.
There is a lot. And I'm sure a lot of listeners haven't heard of the Campbell Foundation, but we will hope to not only inform today, but also to help you even find another reason to seek care at the Campbell Clinic. So the Campbell Foundation, or the Campbell Clinic Foundation, is really dedicated to moving lives of the patients that we serve, moving the lives of the people that we train, and the people that are part of our broader circle at home and around the world. We do so through our three pillars. So the first being surgeon education. The Campbell Foundation actually runs the oldest orthopedic surgery residency in America. In fact, we've had this program to train surgeons for nearly 100 years. But the most important part about that is that they go through an intensive program to really ensure that they can meet patients regardless of their orthopedic needs. And those individuals go on to practice in Memphis, but also in places throughout the US and around the world. We do that with our residency. We do that with subspecialty training through our fellowship program as well. Another piece of that is that we are constantly publishing, and we are publishing more than 150 manuscripts and original papers each year, but we're also the authors of what's considered the Bible of orthopedic surgery, which is Campbell's Operative Orthopedics, which is now in its 14th edition and is authored entirely by our staff physicians at the Campbell Clinic. The second part is our research. So research and innovation are critical to the Campbell Clinic Foundation, and we have upwards of 160 studies going on right now that address everything from pain management to new techniques and implants that are going to help you move better. And then the third thing is our community healthcare, and really making sure that all people, whether they're in Memphis or elsewhere around the world, have access to excellent orthopedic care, and so that they can move and move better, and then also take care of their families and their peers, because they've had the care and they can move more effectively through their lives.
Yeah, I think, let's kind of take some of those and dive in a little deeper. When you look at the aging population and how important orthopedics is to our health, our well-being, our motion, our ability to remain active, there's a huge need for quality orthopedic surgeons, physicians, doctors. And so when you look at that landscape, there's a really important piece of this. And unfortunately, when you look at the healthcare industry, there's a shortage. And so when you talk about the training of what you're doing and equipping and the mentoring, I think that's a really important, bigger piece for our community. Talk about kind of that aspect of the ripple effect of what this creates for us, everyone, as we age.
Yeah. So I read not so long ago that, about 30% of people will be directly impacted by cancer. And I don't know if that's a hard statistic, but it's certain that 100% will be, set back by some kind of orthopedic need. We have joints, we have bones, these things age, they take a toll. And whether you are, riding the sofa or you're out there hiking mountains, we are all prone to having aches, pains, and injury. So you need to have excellent care, and that's, it's not an automatic. So what we really want to do is make sure that our teams, the people that we train, are not only equipped to be excellent orthopedic surgeons, but they're also physician leaders, that they're working with allied health professionals, that they have strong partnerships with other healthcare agencies, that they are really pushing the frontier of medicine so that we can care for people well, people understand what their part is in moving better, and they have the best possible outcomes to do what they love to do.
Yeah, you and I, before we hit record on this, we're talking about some of the international trips, and we've had a chance to interview in the past some of the doctors who've gone on the international trips and been able to share best practices and work with different countries and doctors in different countries. And it's really amazing when you look at the ability to share and learn from each other. Talk about the international aspect of what you're doing.
Yeah, so we have a program with our residency called the International Elective, which is really an opportunity for our residents to work side by side with healthcare teams in developing countries. We've been doing this for about 9 years. We've had residents go to the Dominican Republic and Peru and Guatemala and elsewhere, where they spend 2 or 3 weeks at a time really working hands-on, not only meeting the needs and oftentimes very significant complex cases in those communities, but also working side by side with those healthcare teams so that they're learning, they have access to different supplies and implants, and that they leave knowing that the care in that particular community or village is going to be that much better.
Yeah. Talk about the research, the innovation. I think that's another aspect that really deserves to be highlighted, because when you look at the different treatment protocols, all of this is coming about because your team is focused on that R&D side. And so share a little bit of just what you want the public to know when it comes to the research, the development, new treatments, new protocols.
Yeah. So I think that the most exciting thing, and I mean, I've been around healthcare for about 4 years now, but this is very different, and really, I think, exciting and reassuring as a patient for any kind of subspecialist, because there are just so many things being done, because providers want you to be better. They want to help you. They want you to return to the things you love. And nobody goes to the doctor for fun. There's an expectation that you're going to walk out of there better than how you entered. And so, on the research and development side, we are really looking at how can we better satisfy our patients. And so sometimes that comes with a new implant. It might be that, there's something new that can be applied during a knee replacement to limit infection, or to limit pain, or to just enhance mobility. If your goal is to get back to biking, if you can't move your knee, we've got a problem here. But there's also this larger looming area of how do we reduce pain? And, there's been a lot of work. In fact, we have had several studies to look at how we can reduce the use of any pain medications, especially in the opiate category. And so there have been many trials done, efforts made, but have been extremely successful, not only in reducing or eliminating the use of opiates, but as importantly, to help our patients understand that there's alternate therapies that are going to give them the same result so that they are pain-free much faster, and without any of the residual side effects as well. So I think that there's some really promising things that have an impact on individual patients, but also our broader community and public health.
Talk about the local impact, because you do so much locally to work with different organizations like Memphis Union Mission, where your team will go out and really provide that care. So talk about the local impact.
So our local impact has really been profound, if not behind the scenes. As I mentioned earlier, access to excellent orthopedic care is a foremost priority. And so we work very closely with Regional 1. We are their trauma team with Bonheur. We are their pediatric orthopedic provider. In fact, the only pediatric orthopedic provider in the Mid-South. And so, we provide a lot of care to patients who are uninsured or underinsured in both of those organizations. But more immediately, one of the things that we're most proud of is in 2018, in partnership with Bonheur, we established the Center of Excellence for Cerebral Palsy Care and Research. So in short, this is a one-stop shop for patients with cerebral palsy to get all of their needs met. And by having visited there several times, spending time talking to patients, to families, to the providers, it's a complex disease. It's a very challenging diagnosis. And if you can have all of your providers, all of your services, from wheelchairs to therapy to orthopedic surgeon, all under one roof, not only does it make the journey easier for families, but the outcomes better for our patients to thrive.
Talk about going out and working with organizations like Memphis Union Mission. I think that's a really cool, interactive, amazing opportunity that I've had a chance to see firsthand in terms of the impact, but it's amazing.
Yeah. So your timing is excellent. Actually, next Tuesday, we'll be making our annual trip to the Memphis Union Mission for the Our Hearts, Their Souls Outreach Day. We work with our foot and ankle specialists, our residents, fellows, and a bunch of staff to really provide comprehensive foot care to the clients at Memphis Union Mission. And everyone walks out of there with new socks, new shoes, toiletries, and really on a journey to have healthier feet, which is going to have a really profound impact on their own overall health, as well as their ability to move and start proceeding towards a freer life.
We've covered a lot of ground already in terms of raising awareness for the different things you do, but what's maybe one or two other things that you wish everyone knew about the Campbell Clinic Foundation?
Yeah. Well, first of all, that Campbell Clinic Foundation really is inclusive of a wide family that we call the Campbell family. It starts with our staff. It extends to those who've trained with us. It extends to those who have a copy of Campbell's Operative on their shelf, but it also includes our patients. And, so many patients who've come through our doors and have had one of our providers care for them are beneficiaries of the Campbell Clinic Foundation, because that individual trained here, they're part of our campus, they're part of our culture, and all share a responsibility to, again, moving lives, not just for the patient in the exam room or in the OR, but also minding the needs of their families. So I think it's that everyone, probably, even if you're learning about the Campbell Clinic Foundation for the first time, probably in some big or small way, we've served you, and we hope to continue to serve you as best we can.
So how can we help? I know that you have fundraisers like Footprints in Motion throughout the year that just passed, but you have annual opportunities for the public to get engaged. How can we help? Yeah.
So thank you for asking. We, like every other nonprofit organization, depends on the generosity of our donors. And so, honestly, if a patient is looking for a way to thank their provider, their physical therapist, their surgeon, a gift in their honor is a great way to just say, hey, I feel better. We have annual events and more with things reopening after 2022 that we will be able to engage our community more actively. And then we will also, we have such an amazing team of experts. So if people are interested in speakers, talking about bone health, talking about pain management, talking about how do I prevent osteoporosis, or a myriad other topics, we're eager to serve, we're eager to share our expertise, but most importantly, helping people move better.
Yeah. And last question then is the easy one. Where do we go? So website, social media, phone number, where would you direct us to reach out and get involved and learn more?
So our website is campbell-foundation.org. So all the information you need to know, welcome your feedback. It's brand new, but website is campbell-foundation.org. We are on Facebook. We will soon be on Instagram, but we're really rebooting on social media. So stay tuned and you'll start to see lots more of us in December.
Well, Jenny, you are a change maker for our community. Thank you for all you do to power the good personally and with the Campbell Clinic Foundation. Greatly appreciate you coming on the show.
Thanks, Jeremy. Appreciate it.